Hello, my name is Enos and welcome back to my channel. This is Work and Wonder. If this is your first time, please make sure you click on the subscription button and turn on the notification bell. And anytime I upload the video, you'll be notified and you will come straight here and take a look at whatever video that I have uploaded. So today we are going to continue with our mental health Osce, and I don't want to waste much time. So we'll go straight into it. Today we'll be talking about one of the skill stations. I've already established in my previous videos that we have just 6 skill stations in the mental health Osce, and out of these 6, you'll be doing 4 of them. Out of these 6 skill stations, you have 3 of them that is you can also find in the adult nursing, and then you can also find in the mental health. And today is one of them that I'm going to tackle, which is the nutritional assessment station. Nutritional assessment station. So basically, this is what I'll be looking at. There are a couple of videos on it on YouTube, but I've realized that some of the tools that they are using is outdated. So if you find yourself, or if you find this video, then you are lucky. Yeah, you are lucky. So basically, first of all, let's look at the marking criteria before I even start to talk about the whole thing. So first of all, as you are seeing on your screen, for the marking criteria of the nutritional assessment, we have the first one, which says that you should accurately calculate the body mass index and the score in step 1 of the malnutrition universal screening tool, which is the MASS 2. Then you should identify the percentage of body weight loss, accurately calculate the score in step 2. Then in step 3, you interpret the clinical information provided and accurately calculate the score in step 3. Step 4, you would have to accurately calculate and document all over risk score and identify the correct risk category. Then you document the date, the time, and then signature where required. Then the 6th one is you verbally report the findings to your examiner. The 7th one is you verbally recognize that the patient will need referring to a dietitian or a nutritional support team. Then the 8th one is you verbally propose a plan to improve nutritional intake. Then the 9th one is you verbally propose monitoring the patient nutritional status. Then the 10th one is you verbally consider possible underlying causes and provide food choices. Then number 11 is, of course, your handwriting needs to be legible and clear. And then you ensure that strike-through errors retain legibility. And then in all, the 13th point, you act professionally throughout the procedure in accordance with the NMC code 2018, the code professional standard of practice, and the behavior of nurses, midwives, and the nursing associates. So basically, this is the marking criteria. So if you look at the marking criteria very well, you realize that there are basically 2 steps in doing this particular station, which is the nutritional assessment. But first of all, what is the nutritional assessment all about? We know very well that in most African countries, when we talk about malnutrition, we are talking about undernutrition, and then we are looking out for some deficiencies like kwashiorkor and then the rest. But when you come to the Western world, it's not just undernutrition, but if it's also overnutrition, it's also considered as what? Malnutrition. There are so many nutritional assessment tools or screening tools, but when you come to the UK, they use what we call the MASS tool, which is the Malnutritional Universal Screening Tool, which was developed by Bappin in the year 2003. So basically, that is the tool that they use. So it's shortened as the MASS tool. The MASS tool. So that's what they use, and basically that is what you'll be using to do your nutritional assessment. So first of all, this particular station is 8 minutes, so you are required to use 8 minutes to finish the station, and trust me, the 8 minutes is even more than enough for you to finish and even have time to even relax. And it's divided into 2. The very first aspect is a silent station. When I say silent, you basically sit because there's a bit of calculations that you will have to do. And then when you are done with this calculation, the next part of it is for you to hand over whatever the outcome is to your examiner. So what are the calculations that you are going to do, and how do you hand over to your assessor? So the very first thing, of course, there are 3 key things that you will need to calculate, and they are into 3 steps. So if you can see on your screen, you can see that we have step 1, step 2, and then step 3. The very first one is you are going to calculate a BMI score. Then the second one is weight loss score, and then the third one is acute disease effect score. So first of all, BMI, second one, weight loss, and then the third one is acute disease effect score. As we already know, if we are talking about BMI, we all know that it is the weight over the height in meters squared. But here, this is not the time for them to provide calculators for you, or that. They've given you a very simple tool that will help you to be able to find your BMI. So in order for you to find your BMI, then it means that they should have given you a weight, and then they should have also given you a height. So when you look on your screen, you can see that we have this particular tool which looks like a graph. It has a white portion, it has a green portion, it has a yellow portion, and it has a red portion. When you look to the extreme top, you can see height in feet and then inches. And then when you look towards your left, you can see the weight in kilograms. You can see that the weight starts from 34 kilograms all the way to 100 kilograms. And when you come to the bottom, we also have the height in meters, starting from 1.48 meters all the way to 1.90 meters. Here, all you need to focus on is the weight in kilograms and then the weight in meters, because that is what you are going to use to determine your BMI. So how do you find your BMI? Basically, it's more or less like interception. If you ever did a bit of core maths or a bit of mathematics, we have what we call the interception, where you have two lines meeting. So assuming you are given 50 kilograms as the weight, and then you are given something like 1.60 meters as the height, all you need to do is find your 50 kilograms, as you can see over there, and then find your 1.6, and then you are now going to trace them. So you move horizontally from the 50 kilograms, and then you also move 1.6, and then where they meet, that is where you will find your BMI. So in this case, you can see that the BMI is 20, and it is in the green zone, and the green zone, the score that is allocated for it is 0. I hope this is very clear. Let's do this again. Let's assume the weight is 60 kilograms, and then you have a height of 1.56. So 60 kilograms and then a height of 1.56 meters. So I'm going to move from the 60 kilograms horizontally, and then I'm going to move from the 1.56 vertically. And then you can see that they meet in the green zone at 25. So what it means is that the BMI is 25, and then it is in the green zone. So therefore, the score that I'll get for it is 0. So it is as simple as this. And then I'm going to give a scenario, and then we'll use that to solve it. So don't be so much bothered about it. So that is that for the step 1. Now let's go to the step 2. When you look at the step 2, it says that weight loss score. And then as you can see, weight loss score, they've given you, if it is in percentage and it is less than 5%, it is what the score you allocate for that is 0. If it is between 5 and 10, the score you allocate for that is 1. And if it is more than 10%, the score you allocate for that is 2. So now there is also another tool that they've also provided on your screen. You can also see, if you look at the step 2, right on top, you will see step 2, and then they've written weight loss score. So now let's look at the extreme right, where we have the current weight. You can see that it starts from 30 kilograms, and it goes all the way to 99 kilograms. So from 30 kilograms all the way to 99 kilograms. But when you look at the first or the extreme top, you can see that we have scores. So we have a score of 0, which is in the yellow, a score of 0, which is in the green, a score of 1, which is in the yellow, and then a score of 2, which is in the red. So basically what it means is that if they give you, or if they tell you that in the past 3 to 6 months, the patient has lost, let's say 5, or the patient has lost something like 5% weight, then the patient, you give a score of 0. If the weight score is between 5 and 6, so let's assume 7%, then the score you are going to allocate for that is 1. And then if it is more than 10, let's say 11 or 12%, then the score is 2. So basically, sometimes they can also give the weight to you in kilograms. all you need to do is look for the weight. So let's assume that the weight they gave us is 50 kilograms. So you come all the way to 50 kilograms. And now they say that in the past 3 to 6 or in the last 4 months, the patient has lost 4.5 kilograms. All you need to do is look for where 4.5 will fall. In this case, we know that the weight is 50 and then the weight loss is 4.5. So that falls in the yellow column. And then the yellow column, you allocate a score of 1. So what it will mean is that the patient scored 1 for the weight loss. I hope this is very, very, very clear. And now let's go to the last one, which is the acute disease. What this mainly means is that the patient is acutely ill and there has been or is likely to be no nutritional intake for the past or for more than 5 days. And this one is non-negotiable. All these 2 factors need to be there for the patient to score 2. If the patient is acutely ill but the patient is still able to eat, then it's a 0. But if the patient is acutely ill and is not able to eat or has not been able to eat for the past 5 days or is likely not to eat for the past or is likely not to eat for the next 5 days, then it is a 2. So all these 2 conditions need to be present for you to score the 2. If one of them is present, the other is not, then it is a 0. So here it's either a 0 or a 2. You can see that they said that it's likely not to take food for the next 5 days. What in some scenarios or in some cases, what it will mean is that probably the patient is to undergo some form of surgery and they've asked the patient not to eat for this number of days before they can do the surgery. So in this case, then the patient is likely not to eat for the next 5 days or not to have any nutritional intake for the next 5 days. And then you can classify that as a 2 if the patient is also acutely ill. So basically these are the 3 steps. So now that you know the tools that will be given you, there's 2 additional things that you should expect. As you can see on your screen, we have the documentation of the nutritional assessment. Here you have the candidate name where you have to put your name, the address, the date of birth. That one will be pre-filled for you. But when you come to the date, you put the date there. When you come to the time, you put the time there. So whatever score you had for BMI, you put it there. Then you go to step 2, whatever score you had for the weight loss, you put it there. Then you go to step 3, whatever score you had, you put it there. Then you go to step 4. This is where you add what you had for the BMI, what you had for the weight loss, what you had for the acute disease effect. And now that gives you an overall score. If that gives you an overall score, then you go to the staff name and then your initial. You put your name and then your initials. Now that you've gotten the score, you can go back to this particular document that you are seeing on your screen, right? So we have step 4. Now you've calculated it. Let's assume the score was 0. If the score is 0, then we have what we call the low risk, which there are instructions of what to do. If the patient is at low risk, then you have to repeat the screening. If it is a hospital setting, it's a weekly. If it is care home, it's monthly. If it is community, it's annually. And for special groups, for more than 75 years. Now, if the patient scored 1, you classify that one as a medium risk. So basically what you're going to do is that you document the dietary intake for 3 days. If it is adequate, little concerned, and then you repeat the screening just like you did for the low risk. But if it's inadequate, then the clinical concern, you follow local policies, set goals, improve and increase overall nutritional intake, monitor and review the care plan regularly. Now, if the patient scored 2, then what it means is that the patient is at high risk of malnutrition. Therefore, you would have to refer to what a dietitian if the patient is an inpatient. And then if it's in the community, then you have to refer to what the nutritional support team or implement a local policy. You set goals to improve and increase overall nutritional intake. You monitor and review care plan. If it is a hospital, it's weekly. If it is a care home, it's monthly. And then unless detrimental or no benefit is expected from nutritional support team and there is eminent. So you can also see down there that they say for all categories you have to do this. So you treat the underlying condition and provide help, advice on food choices, eating and drinking where necessary, record malnutrition risk category, record the need for special diet, and follow local policy. And if the patient is also obese, which is more than 30, if the BMI is more than 30, then you have to record the presence of obesity. For those with underlying condition, these are generally controlled before the treatment of obesity. So it is as simple as this. So if you can see, once you are able to do your calculations very, very well, all you need to do is to go and look at where the patient falls. If the patient is at low risk, the patient is at medium risk, the patient is at what? High risk. And then you just follow these set goals or these instructions that are there. You have to know these ones by heart, because you could see from the chart that they say for all risk categories, you could see that there are some things that you need to do, something like you treating the underlying condition, and then you recording the nutritional risk category, and then if there is the need for any special diet, you need to talk about that as well. So basically, that is that for the nutritional assessment. So what we are going to do is that we are going to look at a classical example. Then we'll look at how we'll calculate the BMI. We'll look at how we'll calculate the score for the weight loss, and then for acute disease as well. So I'm going to project the scenario, because obviously when you go, you are going to be presented with a scenario, and based on your scenario, you should be able to calculate your risks, or you should be able to use your malnutritional screening tool to be able to do the assessment. So let's look at the scenario. So the scenario says that Mr. Enosh is a 46-year-old male who was referred by the GP to the community clinic. His weight is 52 kilograms and height is 154 centimeters. GP reported that Enosh has lost 5.2 kilograms in the last 4 months. Enosh has been unwell due to COVID for the past 8 days, has not been able to eat for the past 5 days. He had no support from his families and friends. And now it says that you should calculate the required criteria to assess the nutritional status of Mr. Enosh, and then you institute a plan. It also says that you should complete all relevant documentations on the sheet provided. Yes, so this is a typical example. As you can see, documenting it on the sheets that they have given you is also very, very important. If you did your calculation and you had 3 and mistakenly you wrote 2, they are going to look at that, and then they will use that and mark you down, and obviously you are going to fail it. So how are we going to do this? So basically it has told us the weight of Mr. Enosh, which is 52, the height, which is 1.45 meters, if that is, we are converting to meters, but of course here it is 154 centimeters. So if you have to convert to meters, that's going to be 1.54 meters. And then it also tells me that Mr. Enosh has lost 5.2 kilograms. You must be very, very careful here. Here they are giving the weight loss in kilograms. They did not give it to me in percentage. If they had given it to me in percentage and they had said 5.2%, that is, I could have just gone and said that is a score of 1. Because if you look at the other sheet that I showed you, it says that if it is in between 5% to 10%, then it has a score of what? 1. But in this case, they gave it to me in kilograms. So I will have to use the tool to look for the weight loss, and then I will document that. And here it is also clear that Mr. Enosh has an acute disease, which is what? COVID, and I've not been able to eat for the past 5 days. So clearly for the acute disease, it is a 2. All right, clearly for the acute disease is a 2, because I have an acute disease and I've not been able to eat for 5 days. So here it is what? A 2. But let's be systematic. Let's pick the first 2 that they will give you. So the first 2, of course, I'm going to write my name, as you can see on your screen. Then when it comes to date, today is the 15th of February. So I'm going to put the 15th of February 2024, and now the time is 18 o'clock. So I'll put it there. So now when we come to the BMI, that is where I'm going to pick my tool, and then we look at it. So now let's look at it on the screen. It has indicated that I have a weight of 52. So let's go and locate 52. As you can see, that is 52. And now let's look at the height, which is 154 centimeters. When you convert that to meters, that is going to give you 1.54. So I've now also seen 1.54. So from the 52, I'm going to trace it horizontally. And then when I also trace the height vertically, they meet at 22. All right. So what it means is that the BMI is 22. So BMI is 22, and what score? It falls in the green zone. So that gives me a score of what? 0. So 22, and then the score is what? 0. It is a score that I'm interested in, not the number or not the BMI, the quantity of the BMI. So I'll write what? 0. So now let's go to the weight loss. It tells me that I have also lost a weight of 5.2 in the last 4 months. So now let's go to the second 2. The second 2, what is my weight? My weight is still 52, right? So I can locate 52 on the left side of the graph. And now it says 5.2. You can see that 5.2 falls between the yellow zone. All right, so 2.7 to 5.8. So what it means is that my 5.2 falls within this yellow column, and the yellow column is a score of what? 1. So I go to my other sheet, and then for weight loss, I have scored what? 1. Now, when it comes to acute disease, it is clear that I have COVID and I've also been able to eat for the past 5 days. So that is a clear 2. As we already said, the 2 conditions must be present for you to score 2. If one of them is there and the other one is not there, then it is what? 0. So here I've also scored a 2. So now I've been able to do step 1, step 2, and then step 3. All I need to do is to add what I got in step 1, which is the BMI, plus what I got in the step 2, which is the weight loss, plus what I got in the step 3. So when I add 0 to 1 to 2, that gives me a score of what? 3. So I'm going to write a 3 2 here. And now what I'm going to do is I write my name, Enosh, in the column, and then I put my initials. So what it means is that I had a total score of what? 3. Now that I've got my total score of 3, now let's go to this particular sheet that explains what the scores is for. So I've been able to finish with my step 1, my step 2, and my step 3. Now I've got into step 4 and I had 3. So where does 3 fall? You can clearly see that 3 falls as high risk. So what it means is that Mr. Enosh is at high risk of malnutrition. So that is my 3 there. So I'm at high risk of malnutrition. So if I am at high risk of malnutrition, what needs to be done? This is when you look at the scenario, it says that I came to the community clinic. So what it means is that I am still in the community. So whatever intervention I am going to hand over to my assessor or the examiner should be geared towards what? The community, and that is going to be the oral aspect. But let's look at the sheet. When we look at it, says that you should refer to the dietitian. But as I've already said, if I was an inpatient, then the dietitian would have been right. But here I am in the community, so I'm going to refer to what? The support team, which is the nutritional support team. I'm also going to set goals, improve, and then increase my overall intake. So I'm going to look at goals that I'll set for Mr. Enosh and how to improve it and how to increase his overall intake. Then I'm also going to monitor and review the care plan if there is one in place for community, and then trying to factor out his nutritional needs into that. Now, when you come down there, you can also see that they say that for all categories, you have to do this, which is I have to treat any underlying condition and provide help and advice on food choices, eating and drinking when necessary. Then I record the nutritional risks category, and then I'll also record the need for special diet and follow local policies. In this place, it's not going to apply because Mr. Enosh is still in the community. So now I am done with all this. It is time for me to hand over. All right, it is time for me to hand over. So how am I going to hand over? I have to give an overview of whatever I have done, and then I'll give my recommendation. So in this case, I'm going to say that assessor, I am ready to hand over. Right. So I did a nutritional assessment for Mr. Enosh, who is 46 years old with weight of 52 kilograms and height of 154 centimeters. He has COVID, and then he's not been able to eat for the past 5 days. So I had calculated his BMI, which I had a score of 0. I also calculated his weight loss, which gave me a score of 1. And then the third step, which was that for acute disease, because he had COVID and has not also been able to eat for the past 5 days, he had a score of 2. Putting these scores together, he had an overall risk score for 3, which is a high risk for malnutrition. And because Enosh is still in the community, I am going to refer him to the nutritional support team. I'm going to be setting goals for Mr. Enosh. I'll do a care plan for him where I'll try and factor in his preferences for some food, and then I'll make sure I involve his family members to help me to execute this. But in the meantime, I'll also be treating the underlying condition where I refer him to the physical health team for him to be looked at because he had COVID. And also I record this nutritional risk or his nutritional risk category, which is the high risk, and then so that any other nurse that is visiting him in the community will know that he is at high risk, and therefore the care plan that has been put in place for his nutrition will be keenly followed, and at the end he should be able to get the nutritional requirement that he needs in order to bring him to a low risk for malnutrition. You can add more and more and more of this. We'll look at his preferences, his dislikes and likes. So here, anything at all that you say that is going to help him to bring him from the high risk of malnutrition to the low risk, try and factor it into it. And once you are done with it, it's as simple as that. Within like some 6 minutes, you should be able to finish with this nutritional assessment. So all you need to know is how you'll be able to find your BMI with these tools that they have given you, because this is not the time you are going to divide the height over the weight over the height in meters squared. No, use the tool that they have given you. Go to step 2, try and find the weight loss, and it has clearly been stated there. If it is in percentage, is much easier, but if it is in kilograms, try and use the tool that they will give you, because they are going to give you all these two. And then when you get to the third one, which is the acute disease, make sure that if the acute disease is present and the patient has not had nutritional intake for the past 5 days, or is likely not to have nutritional intake for the next 5 days, then it is a 2. But if the patient is eating all right but has acute disease, then it's 0. So here it's non-negotiable. It's either a 0 or a 2. Then when you are done, add this together to find where the patient stands, whether the patient is at low risk of malnutrition, medium risk, or high risk. And then use under any of this management. There is a management plan for low risk, there's a management plan for medium risk, a management plan for high risk. Know this by heart. If it is high risk, you are supposed to refer, you're supposed to put a care plan in place, you are supposed to treat the underlying conditions, you are supposed to record the risks. So these things, this is what you should have at the back of your mind, and then also how to be able to calculate these basic scores or these basic nutritional entities that you're supposed to calculate. And then it's as simple as that. So I hope I was able to help you with a nutritional assessment. It is not very difficult. Just take your time and go through it bit by bit, and then at the end you'll be fine. You should be able to hand over successfully to your examiner. As simple as that. So until I see you in my next video, it's a bye for now, and don't forget to subscribe to the channel and put in the comment section a station that you want me to do a video on, and I'll surely do that. Until I see you in my next video, it is a bye for now.